Hi, this is Dr. Jake Kaufman with Optimized Chiropractic. Today I'm going to go over with you the most common type of whiplash injury, the 3 phases of a whiplash injury, the areas that oftentimes get injured during a whiplash injury, and how to position yourself in your car to help decrease the risk of a severe whiplash injury. Okay, so first thing, what is the most typical or common type of whiplash injury? The most typical or common whiplash injury is being seated in a car and being hit from behind. In this type of whiplash injury, your position is important because it can help decrease the different mechanisms of injury. So, most of us sit in our car. We aren't touching our head on the back of the headrest. Our shoulders are rolled forward and we have one, maybe 2 hands on the wheel. Shoulders roll forward, head forward, okay? Now this is important to note because if you look at my position, there's a big distance between the back of my head and the headrest. Being that the most of whiplash injuries occur at low speeds and are hit from behind, what is going to happen when I am hit from behind to this headrest and to my body? That brings us into the first phase of a whiplash injury. The first phase of a whiplash injury is going to be extension, where the head is whipped back, and flexion of the head. And now let me explain why. When we're sitting in our car like this and a car hits us from behind, what happens is it pushes our body forward, but our head, because it is not being pushed by anything, because of that distance between the headrest, it essentially stays there. So it forces our head into flexion and our neck and the bottom of our cervical spine into extension. So we're seated here and then we go like this, real quick. Boom. Okay. Extension of the cervical spine where the bottom of our neck goes back like this. Our head comes forward right here. So you have 2 areas of the spine that can be injured, the top of the neck and the bottom of the neck. Okay. So that's the first phase. The second phase is more extension on the lower cervical spine because you've been hit. You're going from that S curve that's created, and then we're hit right here, okay? So you have extension of the bottom of the neck. You have extension of the top of the neck going in to that headrest. So further chance of more extension injuries of the lower cervical spine, and then you go from a quick flexion to a quick extension of the top of the neck. That can injure those receptors at the top of the neck. It can injure the ligaments, the tendons, the muscles, and the neurological structures in the upper neck as well. Okay, that's oftentimes why individuals who have a whiplash injury develop migraines, dizziness, headaches, past that 3 months, past that 6 months, past that 9-month time frame. Okay, so that second phase of the injury is we're just extending and we're hitting the back of the seat. Now, one thing to note here that's important is if you look at my head height, if I were to get in a car wreck and someone were to hit me from behind, my head would hit right at the middle, right there, okay? Now, the reason that is important, because if my headrest was lowered, where would my head hit? Right here at the bottom of the skull, right at the top of the neck, where those ligaments, those tendons are very sensitive. And so you can increase your risk for injury if your headrest is low and not up, where your head would hit more of the middle of that headrest. So first thing, in your car, make sure that you have that headrest higher up so that you are hitting that headrest, okay? Back to the third phase. So third phase, you've gone through the first, second, and then third is cars came to a stop, and then you're whipping forward with your head and neck. So you're going to have flexion of the head and flexion of the neck, okay? So we've gone into extension, and then we've gone into flexion all the way. Now, obviously, this is the part where the seatbelt is important. You want to have a seatbelt on. So the different areas that can be injured during a whiplash injury typically are the bottom of the neck, the top of the neck, the upper cervical spine. What can happen is you have the extension injuries, you have the facets, you have the muscles that can all be negatively affected during a whiplash injury. You also have the neurological structures in the upper neck. You have the vertebrae C1 and C2 that are connected to nerves that go up into the face. So sometimes individuals after a whiplash injury will develop face pain, will develop symptoms that aren't typically associated with whiplash disorders. So it's important to note that these two areas can be injured, but because those two areas are connected to the brain and connected down through the arms, oftentimes we'll develop symptoms down our arms, through the head, through the neck, those migraines, those dizziness, headaches after whiplash injury because of the amount of force that is put into those areas. One of the important things about getting assessed or getting looked at after a whiplash injury is obviously you want to look at the muscles, you want to look at the structure, but another thing that you want to look at is you want to look at the eyes, you want to look at the balance, because the amount of trauma that goes into the head and the neck during that time, it can throw off how the body is able to properly process the information going from the eyes to the brain, from the structure to the brain, and from the vestibular system to the brain as well. That's one of the reasons that they think individuals that have whiplash associated disorders, again, those disorders that are after the 3 months, after the 6 months, after the 9 months, take so long to heal because those three systems can get disrupted during a whiplash injury. So, takeaways: raise your headrest. Okay, you want that headrest to be halfway up where your head is hitting it while if you drive. You also want to drive with your head back up against the headrest. That's going to help decrease your chance of developing an injury while you're driving. So sit up straight while you drive, look ahead, and please remember, do not put your foot up on the dashboard. Have a great day.